Good to see so many people joining us this afternoon. My name's Patrick Mitchell. I'm the Director of Innovation, Digital and Transformation at Health Education England and the Senior Responsible Officer for the DART-ED programme as well as the Digital Readiness programme in HEE. Delighted we've got so many people joining us. Can I ask people to turn their cameras off and to put themselves on mute, please, during the session? And obviously, as we come to Q&A, we can bring people back in. But it'd be hugely helpful if you could cameras off and mics off. Thank you. Absolutely delighted that HEE is able to work across the digital skills agenda, particularly looking at the implications of AI, digital healthcare and robotics on the NHS workforce following the TOPL review, which was published in February 2019. This is one of a number of webinars we're going to be running, and I'm now going to ask the team to introduce themselves and then get into the presentation. So we'll kick off with Hatim.
Thanks, Patrick. My name is Hatim Abdul Hussain. I'm a GP registrar in North West London, and I've been at Health Education England working as part of our new digital AI robotics in education and training program.
Thanks, Hatim. Brahmi.
Hi, everyone. It's good to be here. I'm Brahmi Balaram. I'm the head of AI research and ethics in the NHSA Lab, and I lead our AI ethics initiative.
Fantastic. And Richard.
Good afternoon, everyone. Richard Price. I'm the Learning Technologies Advisor here at Health Education England, part of the Technology Enhanced Learning team. So we look at all of the different touch points where potentially technology might be able to support learners with their education and training.
Great. Thank you, Richard. So we'll kick straight off. Hatim's going to give an introduction. Brahmi is then going to do an introduction to the AI Lab and the collaboration with our programme. And Richard's going to be talking about our Technology Enhanced Learning programme and how it links to this piece of work. So over to you, Hatim. Thank you.
And Patrick, I'm just going to bring my screen up and I've just got some slides to share with you today to give you an overview. So, this really all started with the TOPL review, which was published in 2019, which made quite clear recommendations around education and training of our current and future workforce, around increasing the numbers of clinicians with knowledge and skills around AI and robotic technologies and other digital healthcare technologies, as well as some specialist skills in our healthcare scientists, our technologists, and our knowledge specialists as well. And it's quite clear from our point of view at Health Education England to continue looking at our current workforce and how we can support them to work in a digitally enabled system, and our future workforce to ensure that they'll be able to work into a system that's going to continuously adapt and transform digitally. Some of the definitions are really important. So the TOPL review defined AI as a broad field of science encompassing not just computer science, but psychology, philosophy, linguistics, and other areas, and is essentially concerned with getting computers to do tasks that normally would require human intelligence. The TOPL review also defined digital medicine as digital products and services that are intended for the use of diagnosis, prevention, monitoring, and treatment of disease, condition, or syndrome. And this can encompass a whole range of technologies. Many of these technologies we are now using daily in practice, like telemedicine. There are many patients or consumers that are using some of these technologies themselves in terms of smartphone applications and wearable devices, for example, and coming to have conversations with us about those. And there's emerging sort of softwares that we use, such as e-prescribing, electronic healthcare records, point of care testing, and then emerging technologies like extended reality technologies, such as virtual reality, augmented reality, could have quite interesting healthcare applications. So our program has 3 key projects. The first project is looking at the impact of these AI and digital healthcare technologies on education and training, which we've been working with a wide range of partners with. The second project is with the Royal College of Surgeons, looking at robotics literacy as part of their RADAR initiative. And then we've also been working quite closely with the British Association of Dermatologists, looking at developing digital leaders in dermatology. And we'd love to continue that sort of relationship with the British Association of Dermatologists, but other faculties, other colleges in thinking about that journey. All of this work is overseen by our Digital and Education Steering Group. So we're looking at this from 3 means, really. One is horizon scanning, knowing what's coming. And so we've been looking at AI technologies in particular and creating an AI roadmap to see how many technologies are out there currently in the system, how far are they away from scalability or deployment, what kind of workforce groups do they affect, and what kind of workforce impact do they then create. And also taking some deeper dives into a couple of these technologies to understand that a little bit further. We also need to be really proactive and really assess what the learning needs are. So we're continuing some of the work that was done previously at HE to develop a digital literacy framework to understand what the learning needs are going to be and the capabilities that our workforce are going to need for AI and digital healthcare technologies, with a view that actually this will provide a basis for a curriculum. You can look at this, you can pick up the capabilities and map it to your professional workforce group and build that into an undergraduate or postgraduate curriculum. And it also can help us to direct where we're going to deliver some of our education and training and opportunities in this space. So if you go to the Learning Hub now, you'll be able to see one of our catalogs, which is Digital AI and Robotic Technologies in Education. And there will be some learning materials that are already signposted to within that catalog. But what we hope to do is continue to build that catalog for it to be sort of the go-to space if you want to look for extra learning in this area. And the reason why you're all here today is because you are interested. I want to quickly run through in terms of what the plan is for the future. So this is the start of the DARTED webinar series. All webinars will be free to attend. All webinars will be recorded and added to the DARTED catalog on the NHS Learning Hub. And if you keep an eye on the DARTED website and the HE Digital Readiness social media platforms, that will give you an idea for when the webinars will be coming in terms of exact dates and what they'll be covering. This is our first webinar where we're talking about digital AI and robotics across the system. In the future webinars, we're going to explore themes such as ethics and confidence in AI in early next year. In the spring of next year, we're going to be looking at nursing and midwifery and digital and AI and nursing in that space. We're going to have a spotlight in AI and healthcare in this late spring of next year, followed by a webinar over the summer around dentistry, and culminating in a webinar around robotics-assisted surgery in the autumn of next year. So that's the current plan going forward, but we hope to continue these webinar series, and we're really pleased to see the engagement that we've had today. If anyone wants to get in touch, feel free to reach out. And I'm now going to pass over to my colleague, Richard, to my colleague, Brommy.
Thanks, Hatem. Okay, so the NHSA Lab was established in 2019 with the mission to enable the development and adoption of safe, ethical, and effective AI-driven technologies in the UK health and care system. So one of the main ways that we're doing that is through supporting innovators to carefully scale their technologies for use across the NHS. And we primarily do this through the AI in Health and Care Award. And we have a number of technology companies that are CE marked, meaning that they have regulatory approval and that we are now supporting with evaluation of their products. So alongside the AI award program, we also have Skunkworks, which develops proof of concepts that are often proposed by healthcare practitioners who are identifying a particular need. We have the AI imaging program that is currently standing up a national medical imaging platform to support training and testing of imaging-based AI products. And we also have the regulatory program that is working with organizations like MHRA and NICE to streamline the regulatory pathway. So for example, they're collaborating on the creation of a multi-agency advice service which would bring together regulatory information and make it accessible through a single portal. I lead our AI ethics program, which was launched earlier this year in February. We support research and practical interventions that can complement and strengthen existing efforts to validate, evaluate, and regulate AI technologies in health and care. And we have a particular focus on countering the inequalities that could emerge from the way that AI is developed or deployed. And one of our main objectives is to support a key goal of the lab, which is to build trust and confidence in AI systems. So we're therefore investing in a number of practical interventions, such as working with the Ada Lovelace Institute to develop a model for algorithmic impact assessments that can be used as a condition of accessing data from, from the National Medical Imaging Platform. The project that I wanted to highlight, however, is a partnership with Health Education England. It's being led by Dr. Michael Nix and Dr. Annabelle Painter with support from one of our colleagues in the lab, George. And the project is specifically exploring how to build appropriate confidence in AI among the health and care workforce. So we want staff to feel like they have enough confidence to use these technologies, but we don't want them to be overconfident in these technologies to the point where they are overriding their own judgment or placing more trust than is warranted in a certain product. So this is obviously a very difficult balance to strike, but that's what we're trying to aim for. And I think part of how we will get there is by being clearer about the expectations we have of these healthcare staff when using these technologies. So for example, in relation to their role in post-market surveillance, there's a certain level of knowledge and understanding that healthcare staff need, and that can be gained through a training course, but they will also need to be supported at national and local levels. So this project also looks at the roles of senior leadership in driving and shaping the use of these technologies in the workforce. I think
Thank you.
Richard.
Now handing over to Richard Price. Richard.
Thank you, Patrick. Thank you, Brummy. Good to be here. My name's Richard Price, as I said, and I work in a team called Technology Enhanced Learning. So that's a team within Health Education England. It's a specialist team that's responsible for looking at all of the different points where potentially we might come across education and training, where technology might be able to support that education and training. And that's all the way through from pre-16, when somebody's first starting to think about career in healthcare, through their undergraduate and postgraduate education, all the way into the workforce and potentially beyond as well. So, like I say, a huge area to cover. Look at the sort of training of 1.2, 1.3 million people, and how technology can potentially support all of those things. And we do that in a number of ways. So the main delivery mechanism that everyone's familiar with are our delivery platforms. So Hattie mentioned briefly the Learning Hub, which is our new platform, and it provides free access to a wide range of informal resources that are shared and contributed by the community. So they're potentially things like e-learning courses, but also things like video, audio, images, podcasts, web links, all of those different things that you might come across from an education and training context. We then have a second platform called eLearn for Healthcare, which is very much our formal offer. There's 450 or so programs on that, including, I guess, our flagship program at the moment, which is coronavirus and the vaccination program. We've had millions of users that have accessed that and gone through that training. So we're really proud of that. That was produced in response to the pandemic. So that, again, is freely available. And we're starting to see some content on AI starting to make its way into all of these platforms. The third platform that we offer is called Digital Learning Solutions, and that is very much about the IT side of training. So it hosts that sort of national digital capability, digital literacy content, as well as sort of details of clinical systems and the more familiar sort of office tools that you're probably familiar with and things. So quite a broad range of different systems that we offer as part of that. Alongside that, we have programs that support simulation and immersive technologies. So you might have seen some of our work around HoloLens, for example, which is a head-mounted display that provides virtual augmented reality content. We also have virtual reality offers and things like that as well as part of that. Again, all available via those three platforms. Third area just wanted to focus on was our regional networks. So these are a new set of partnership managers essentially that we've created at a regional level that give us access to individuals working in hospitals, in local care offers and things like that. And that is a way of supporting those individuals, those organisations, with access to IT, for example. So making sure that they've got access to sufficient Wi-Fi and things like that to be able to deliver some of these AI-enabled features that we're talking about today. So it's a really exciting team, lots happening, and that's a very, very brief overview.
Brilliant. Thank you very much, all three of our speakers. I hope that's given people a taste of what we're up to. I've got three questions that came in from people earlier, which I'm going to pose to you all, and then we'll have time for Q&A from the audience too. But the first question, what new skills do healthcare professionals need to develop, and how do you plan to help patients and staff adapt to technological changes? So, team, do you want to take that first?
Thanks, Patrick. This is where I believe our capability framework will come in. So this is where I mentioned the learning needs analysis beforehand. We need to spend some time understanding what those skills are going to be. So how we've done this is we worked with the University of Manchester. We did a systematic review to look at the existing literature out there. We held a series of focus groups and workshops with key subject matter experts, those that are working directly with technologies on the front line, some leaders in education as well as industry experts who are developing and innovating in these terms of these technologies, to identify what they felt, based on those emerging technologies, our healthcare professionals are going to need to understand or need to know. And this framework will provide that guidance across various factors. Some of the skills that it talks about, some of the skills that were emerged from the top review around data curation, integration, provenance, security and safety around that data. It also goes into some basic skills around digital transformation. There are skills around some of the human factors. So with interacting with these technologies, what kind of impact does it have on that relationship with your patient? What kind of impact does it have on the relationship with your team that you work within? There are also factors around ethics, and I'm sure Brummy will provide a lot of insight into this. And these core themes will essentially form what is a curriculum in AI and digital healthcare that can then be lifted and used by educators to be put into curriculum and training, but also can be used by an individual learner who wants to learn in this space to say, actually, this is.
You've gone on mute, team.
Oh, sorry. When did I cut off? So it can be used by educators to lift and put into education and training, but it can also be used by the individual learner to say, this is what I now need to know. How can I then use this to go out and find the resources and the knowledge that I need based on these factors? So I think it empowers the individual learner, because we know actually from the evidence that we are all seeking knowledge in our own time and space around these things.
Thank you. Brummy?
Thanks. So I think on this question, healthcare practitioners will need a foundation in digital literacy to build from, but they'll also need to acquire AI-specific skills and knowledge. So for example, they will need to learn to understand AI outputs and their limitations, and they will need to be reasonably critical of the information presented by AI to avoid automation bias. And I also think that we should emphasize the need for soft skills to support changes in the relationship between patients and clinicians. So as AI is increasingly used for diagnosis, for example, healthcare practitioners will need to take on more of a health counseling role as opposed to just relaying information. As AI takes on more physical, repetitive, and basic cognitive tasks, it'll be more important than ever that clinicians are able to demonstrate empathy and emotional intelligence in their communication with patients. And as for preparing the public, I think that there will need to be greater engagement and education in order to ensure a holistic approach to deploying AI technologies safely and effectively. So for example, there are some instances of healthcare practitioners in industry exploring how to engage patients on issues of consent. And I think it'd be useful if there could also be more engagement to demystify AI, also to address fears and clarify the limitations of these technologies as well.
Brilliant, thank you. And Richard?
Thanks, Patrick. So I think what we're seeing in the education space is that people are starting to move into this hybrid working model. So we're seeing a lot of people with portfolio careers and perhaps sharing their skills and competencies across different organizational boundaries and things like that. So I think what we're seeing is learners starting to manage their own learning, their own portfolios and their own competencies as a result of that. So for me, I know both Brummy and Hatim have talked about this, but I think for me, the digital capabilities are going to be key. So that is things like, to introduce another framework, I suppose, our own digital literacy framework of digital capabilities that are part of that. We're going to need people that are flexible and adaptable to that different culture that's going to happen as a result of these different ways of working and the introduction of these AI and robotic surgery technologies. And I think to some extent we're preparing a workforce for a future that we don't even know what it looks like yet. The top overview talked about some of those different changes, those challenges that are going to be presented, but actually we're not entirely clear on what that's going to look like ourselves yet. So a lot of this is preemptive work and like I say, getting people ready for those changes. And I think digital literacy really underpins that and is key to getting people in the right space, the right frame of mind for that.
Brilliant, thanks, Richard. Second question, how are or should HEIs equip pre-registration students in the use of AI and robotics in healthcare? So, Brummy, do you want to kick that one off?
Yeah, so I think that higher education institutions could start to embed a basic level of AI-specific knowledge within clinical education. So, for example, they could teach students to appraise evidence from AI-derived information, which would be similar to the usual criteria for assessing academic papers. They could teach students about how AI technologies are developed and trained for use in healthcare. They could relay what's required to develop and maintain optimal AI solutions, so introducing concepts of data quality. I think we could also teach students about how AI is validated. And I think it's really important that they reflect on critical points of integration with the health system and how poor implementation could actually weaken the performance of AI. So I think it'd be really important for students to understand that algorithms can perform differently in different settings because of the way that they're introduced or operationalized in a clinical pathway. I I think that there probably actually isn't a need to teach code or advanced statistics. So basic concepts, statistical concepts are already being taught in medical school, like diagnostic accuracy, sensitivity, and specificity. So I think that that should be sufficient. But again, I think that there needs to be an emphasis on soft skills. So kind of what I mentioned earlier in terms of thinking about how the relationships between patients and clinicians are going to change as a result of the introduction of some of these technologies.
Brilliant, thank you. I'm glad you said we don't need to teach code, or not for this group of professions anyway. We certainly need people who can do code, but that's in a different group of the digital workforce. Richard.
Thanks, Patrick. So, as I said, I think we're preparing a workforce for a future that we don't even know what that looks like yet. But I think what we are seeing is a trend towards, as Brummy touched upon, sort of e-patients, for no better word. So patients starting to manage their own care at home using wearable devices and things like that. And AI is really key to being able to analyse that and notify a clinician when they need to do an intervention and things like that. So I think we're going to need a workforce where clinicians are relying much more on that technology, potentially using much more telehealth, telemedicine. So those are going to be skills that we need to teach our workforce to be able to deal with that different way of liaising with patients, but still care being at the heart of that, still that bedside manner, as we used to call it, being at the heart of that. So from an education point of view, I think where we're going to see AI coming in is much more around personalised and adaptive learning. So if you think about somebody about to do a ward round, for example, they might have a tablet in front of them that has a list of all of their patients that they're about to see. If we can map that information on the screen there to their own training record, we can go, okay, this clinician is about to see a patient with sepsis, for example. We know from their training record that they've not seen a patient with sepsis, or they've not done any training on sepsis for a number of years. So actually we can intervene at that point, give them some personalised just-in-time learning, which might be a video or something to give them that confidence to be able to treat that patient and give them the information they need. So that's that kind of predicting learning of what they need. We can also start to see AI being used to adapt the way that we deliver training. So if somebody's struggling with a particular subject, we perhaps focus a little bit more on that, and we can start to look at outliers and things and support people before they start to struggle. So actually just in time interventions that are actually supporting those learners before they even start to get to a point where they're potentially going to fail or struggle with their course. So there's some real opportunities, I think, in how we can use AI in the education space.
Thank you. I think that one in particular around being able to track people and help them where they're particularly struggling with particular subject areas is going to be hugely helpful when you think of the cost of attrition from healthcare programs. It could be a real opportunity there to gain and to make sure that we don't lose those people from the training pipeline. Final question, and this is one I think for her team. What medical specialties and roles can we anticipate being heavily impacted by automation, resulting in greater or fewer posts and vacancies? So, Hatim, do you want to take that one?
Thanks, Patrick. The first thing to say is this is a really interesting topic and one that we can really share a little bit of insight from the work that we're doing around the AI roadmap and the dashboard that we're actually developing, and we're soon to publish, so do keep your eyes out for that. And that is really important because it gives us an idea of currently what kind of technologies what kind of AI and data-driven technologies are in the system and how many of them are there. And I mentioned before, it talks about clinical workforce groups that are going to be affected by these technologies. Now, first thing I want to caveat with is actually, regardless of the technology or the workforce groups that we know are going to be affected by AI, we have to recognize that actually to work effectively with AI, you still need a human in the loop. You need someone in that process. So it's not about change in the number of people we necessarily need in a lot of these areas and specialties. It's more about how we support those areas, those working in those areas, to work effectively with the technology that they're going to be using to enhance patient care and optimize the patient pathways that we have in our current system. That's the most important thing to recognize. We know that at the moment there's a clear shortage of certain workforce groups. So actually, there's a big role here that digital transformation can play to actually enhance enhance and support us in delivering a care and making us sort of more efficient in the way we deliver care as well. So the AI roadmap tells us that there are quite obvious clinical workforce groups that are most likely to be affected by AI and data-driven technologies in the short term. And these are groups such as clinical radiologists and radiographers. It's also workforce groups such as general practice, cardiology, adult nursing. These are some of the workforce groups that are quite clearly coming up in that chain of workforce insights that we do have. Now, an important thing to recognize is actually when I say a workforce group, there's a massive team that works around that workforce group. So if we talk about general practice on a day-to-day basis, I work in a surgery with a practice nurse, advanced nurse practitioner, sometimes paramedics and physician associates, significant administrative and reception support. So if I'm going to be using an AI and data-driven technology in my practice, what impact does that have on my colleagues? So if we say it affects the general practitioners, it's also going to affect that wider team. What does that mean in terms of change in workload? So if I'm using something to then triage patients through automation, the type of work that eConsult are doing and what they've been awarded an AI award for, when they triage that patient, it's going to go to a doctor, it might go to a pharmacist. Who's the point of contact when that patient is triaged? Is that the receptionist? This is what we need to try and delve deeper and understand. So the dashboard is really interesting because it gives us that initial insight, but now we need to look at specific case studies. We need to look at specific technologies and what impact they're having at a patient level. So in the AI roadmap report that you'll soon hopefully have eyes on in the near future, there will be 2 case studies within that. And one of those is OxyHealth, which is a technology which is used on mental health wards and essentially allows patients to be monitored on the ward by the nursing staff, by the clinical staff on the ward more effectively. And in that case study, we're really able to dive deep and say, okay, what did that actually mean for the way we then delivered that care in that ward and the way you monitored those patients on the ward, and what impact did it have on the patients themselves? And you'll find that actually patients found it really helpful because they didn't need to be woken up to have their observations taken every an hour or so, or every 2 or 3 hours. This was done autonomously. It was sent back to the nursing staff, and it created a better relationship between the patients and between the staff delivering that care. Another technology that we're going to have a deeper dive into is something called Optellum Health, which looks at diagnostic radiography. And again, if we're improving diagnostic radiography, what impact does it have on a radiographer and the radiologists that are within that workflow, and also the medics who are requesting the scan in the first place, and ultimately, what is the patient impact? So as we dive deeper into the understanding these, we can actually use these technologies effectively, but also understand what skills we need to support in terms of our training for the workforce that are going to be using these technologies. And I think that's the most important thing to recognize, rather than worrying about vacancies and jobs. It's how can we make sure that we have the right skills to use the technology?
Thanks very much, Atim. Really helpful. I'm going to open up to questions, and Chris Munch has asked the first question. Chris, do you want to answer openly to the audience?
Yeah, just a word of caution, really. We know that about 80% of healthcare data is unstructured. It's in a mess, basically, and is not easily available to AI to create the algorithms. Should we not be getting our data in order and into shape before we get too carried away with the potential for AI?
Thanks, Chris. Good challenge. Who wants to take that one first?
I'm happy to take it. I mean, I think it's very important. Chris, it's a really relevant point. And we have to establish that actually, from an education and training point of view, it's irrespective of how good the technology is yet, because we still need to understand it. And actually, if we're going to get to where we want it to get, if you want that data to be more structured and to be used in practice, you need both data scientists. You need understanding amongst healthcare professionals in terms of putting that data into the system, coding that data appropriately. And I'll give you a very real life example of something that happened to me last week in practice. So I was there going through our results. I was going through my labs. I was looking at the COVID results that came back. And I was just filing the COVID ones that are positive and negative. And my trainer came into the room and had a conversation with me and said, actually, the ones that we actually code that come up COVID positive, we need to make sure we code them as COVID positive. Something that, hadn't been made aware of, but actually has a significant impact in terms of the data that NHS Digital, for example, collects, and a significant impact in any potential technologies that are going to be using this data. So if we don't code things properly and we don't understand why that's important, then we're not going to get to where we want to get to. So that's really important to understand. Is our role really from an NHS point of view is to ensure that we give the right skills to actually get to where we want to get to, and then we need to be doing that right now. So we're not necessarily running before we walk. We're putting everything in place that we can do to help us walk in the first place.
Can I also come in on this question?
Please do.
Yeah, so I agree with what Hatem's saying in terms of we're able to do a lot of things like simultaneously in terms of making sure that the adoption of these technologies is effective and safe and ethical. But just to highlight the importance of the question that was asked, I think that there's like a really interesting analysis that was carried out by the University of Cambridge relating to algorithms that were developed during the pandemic. They had reviewed a number of academic publications related to these algorithms, and they found that out of like thousands of papers, that there were only like 29 algorithms that had sufficient documentation to be reproducible, but that a number of them still had severely biased data sets. They weren't externally validated, and they didn't have proper sensitivity or robustness analysis. And what the authors of this paper talk about is this idea of Frankenstein public data sets. So public data sets that are combined and are used by researchers and developers who are unknowingly training and testing their models on data sets that are overlapping. So I think that we've recognized in the AI lab that there's a lot of demand for something like the National Medical Imaging Database that's essentially curating a publicly available data set that will hopefully be interoperable, but will also enable proper validation of these types of algorithms so that they can be used on their intended populations in the UK. So this is something that we are currently working on actively.
Absolutely. And if I could just add to that, in terms of thinking about the education side of things again, a lot of the data, I would go a step further than what Chris has asked in his question. I think in some cases the data doesn't exist. So we need to start capturing that. And actually, I think if you think about simulation, for example, simulation mannequins are really sophisticated now. They can produce huge amounts of data, and that tends to not be stored anywhere or captured anywhere. So a lot of us are working behind the scenes now to look at AI-ready data standards. So the Experience API being an example of that, X API or Project TinCan, as you might have heard it called in the past. It's all about capturing all of that really rich data set in a format that's interoperable and allows us to do an awful lot with it. I think the other thing just wanted to briefly touch upon is the power of taxonomies in all of this. I know those of you that know me know that I bore everybody to death with my love of taxonomies, but do you know what? They're really important. They're our superpower. If you don't get your clinical coding right, if you don't get your richness of your data, it's impossible to match everything up. If we're thinking about trying to map what I was talking about earlier, clinical data sets with education data sets, the only way you're going to be able to do that is to have a bunch of synonyms behind the scenes that link different clinical codes together. So there's some huge fundamental work to do there with taxonomies. I'll get off my soapbox now. Thank you.
Thank you, Richard. For anybody who knows Richard and goes to meetings with Richard, you'll know that taxonomy comes up at least once in the meeting, which is great because it really stresses the importance and reminds us of the importance of getting it right. We've got a couple of questions coming in. So Dermot first and then Rosie. Dermot, welcome.
Well, thank you very much. I kind of regret asking the question now, but it's actually on taxonomies and data because we have an AI which actually manages the mappings between clinical codes, and it's just come to market this year, and we're just seeking the right area of the NHS to bring it to. We are trialing it with one of the large companies in the UK at the moment. But we really want to get it into a real clinical setting to find out how to make it ergonomic. It's actually quite simple to operate, but we want to make it even simpler. So any advice on angles there would be really appreciated.
Who wants to take that one?
I think it best be me if it's taxonomies.
Go on, Richard.
I guess from our point of view, I think we've learned a lot of lessons along the way when we've been trying to implement taxonomies. I think we had an idea of reinventing the wheel, if I'm honest, when we first started going, yeah, we'll build our own taxonomy. That was a really stupid idea. There's some fantastic open source taxonomies out there that we can use, and I guess you end up sort of just doing the bit that you specialize in. So use SNOMED, use MESH, use the World Health Organization ICD taxonomy. It's all there for the taking. What I would say is those are really specialist taxonomies, and they tend not to cover some of the nuances of the UK landscape. So that's where we've had to build our own taxonomies to fill those gaps. And I think, again, I would focus on your area that you're specialist in. There's no point in building a taxonomy. I don't know anything about radiology, for example. So why would I build a radiology taxonomy? I would build one about an area I do know about, which is education and training, and then outsource that to an area of the NHS that knows that area really well. And then you end up with specialist taxonomies being developed, maintained by specialists across the system, and sharing those as one big happy NHS family, as it were.
Thank you, Richard. Rosie, your question.
Yeah, hi everybody. So to introduce myself, I'm Rosie and I work for HE Southeast, and I'm the programme lead for simulation, TEL and patient safety. And I've now got a programme board with three associate deans, and so we've got the governance structure. So we're in a really good setup. And I've just had funding for simulation fellows in each of our counties. So actually I've got 8, hopefully starting in January, and then another 5 next August, and they'll be doing a PG cert in simulation with this. I just wanted to, it's not a question, I just wanted to say that this is what I've got. So I think it'd be great if we could link up, or, you know, when I get these fellows, how could I steer them into their projects, bringing something, you know, a really coordinated kind of output at the end of it. So just to say hello really, and hopefully invite you at some point to come and talk to my Sim Fellow network would be brilliant.
Thanks, Rosie.
Can I just say a few words about that? I mean, I think there's 2 aspects to this. There's one, using digital in education, so the technology enhanced learning, and simulation is obviously the core to that. And actually, if you build on simulation and you use immersive technologies on top of that, and maybe in the future start to use, you know, AI and data principles on top of that as well to create a really interesting educational offer, that could be fascinating. And then, of course, there's the other side of things, which is around the literacy and the capabilities that you want to get into training. And some of that is getting hands-on experience of these technologies in practice, and some of that is just understanding what you need to know at a base level. So from our point of view, this is exactly what we're trying to do. We're trying to build that network, you know, so we're trying to understand what's happening regionally and really understand where the good evidence and the good practice is happening, and be able to scale that up as well and share that. So we'd love to connect, Rosie.
Thanks, team. Can I put another question that's come in separately from the audience? How do you plan to help patients and staff adapt to technological change? Who wants to take that in the first instance?
I can have a go. So I can, yeah, absolutely.
Have a go.
So I think the first thing is we have to recognize that everyone has different levels of digital literacy and digital capability. And we have to recognize that, because it's really important, because it gives us a base from where to work from. And the other reason why it's really important to recognize is because what we want to avoid here is digital exclusion. We don't want patients missing out on good healthcare because of not being able to access care due to technology. What we want to do is we want to use technology to enhance patient care. So with that context, I think it's really important that we're going to need to be able to educate and support and increase skills amongst patients. And I think that's something that the NHS really needs to start thinking about. And it's really important because as healthcare professionals, we can do that to a certain extent because we always have patient contact. But at the same time, we also have lots of other responsibilities. And the core part of that patient contact is providing care and providing, you know, healthcare. So it shouldn't be really necessarily built into our roles that it's a must. It's something that we have to do, but it's something that we should be able to help a patient through a process. But we still need some sort of digital champions who are going to help patients become more digital literate and use some of the tools that they might be using to access care. I think that's really important. And in terms of staff, again, I think organizations need to take responsibility for this to some extent and recognize that this is something that we need to work on. We need to make sure that our organizational members are digitally literate to a certain extent to use the tools that they need to use day in, day out. I've had many an occasion, and I'm sure many on the call will have had, where you've gone into a department and a technology has been brought in and you've not had any education and training around that. And that is a concern for me, because actually you're then expected to use a new system without the support to use that system. And we're always going to have new systems because this transformation is happening rapidly. So we need to ensure that actually anything that is brought in, anything that is procured, anything that is implemented has a quite clear education and training strategy around that to support the staff to use it.
Brilliant, thank you, Bremi.
Can I come in on this, just thinking about patients specifically? So I think that really early patient engagement is very important here, and we can kind of see that in relation to like the rollout of like GPDPR, for example. So there was 1 million people that opted out, which pushed back the rollout, and we're now reconsidering how we actually engage patients on this matter. But I think that the lessons that can be learned from something like that can also be applied within the context of how we roll out AI technology. So, for example, with our work with the Ada Lovelace Institute that I mentioned, we're trialing these impact assessments, and there is going to be a public and patient engagement aspect to that. So, for example, when these technology companies or research institutions apply for access to data through the National Medical Imaging Platform, we will ask them to fill out an assessment that prompts them to consider the legal, social, and ethical implications of their technologies. But we'll bring in patients to also help them consider some of the potential impacts of these technologies on different patients and communities. So thinking about helping them think through potential unintended consequences, or even like the positive benefits of these technologies. So I think that hopefully by involving patients at that really early stage, that will also positively influence how these technologies are developed, and then also for patients to better understand, like how these technologies can be applied for their benefit.
Great, thank you. I've got a final question coming in. Do panelists feel that we are placing enough focus on data in the curricula for the composition of teams required to push forward developments?
I mean, I'm going to say no. I'm going to say we are, but I'm going to say the system perhaps is not quite where we would like it to be. And that's fine, because I think that's recognizing that there's always lots of other, challenges that we're dealing with. And we're also still in the middle of the pandemic, so we have to recognize that. But I think there is some meaningful change happening. So the Royal College of Radiologists, for example, have adapted their curriculum to ensure that there are aspects of AI within that. Same for the radiographers, and same for pharmacists in their postgraduate curriculum. So these early examples are really useful, because you need early implementers to be able to create further ripples of effect and ripples of change elsewhere. And I think the same is happening at undergraduate level. So there's many universities that are starting to look at this in their curricula, and there's many people that are interested in this. The challenge we do have is educators that understand this space. And I mean, that was highlighted in the top review. We need a cadre of educators that understand digital tech, AI, to really get the changes that we want and need in practice. And I think that's starting to happen. And so that's really important, is if we can recognize those talented individuals that are keen to progress this agenda forward and are keen to implement things locally in curricula, in teaching, in education, then we need to enable them and have to give them the space to be able to do that. Now, the other challenge we will always have is there actually space in the curriculum for this? Well, I think there is, because digital is integrated in everything we do. It's not something that you will only do in a certain placement, for example, or a certain piece of work, or a certain professional group. All of us will be interacting with technology. All of us will be affected by emerging technologies like AI and data-driven technologies. So it's something that we need to recognize. It needs to be integrated to curricula. It doesn't need to be something that we need to add on. It needs to be integrated in terms of what we already do.
I'd add to that, and if you look at the work that HE is doing in its digital readiness program, we're now broadening the offer out for a whole range of learning materials, particularly that people can do in bite-sized chunks, so that they can slowly develop the skills they require, the information they require across the whole digital spectrum, and particularly now focused on individual professions, not just the masses. So although we're doing a self-assessment tool for digital skills for everybody in the NHS, which will be available after Christmas, we're looking to now try and do really niche digital skills needs for the individual professions, working with the chief professional officers and their teams to work out what is needed. So we're still very much in the foothills, but look out for more. And this will all be available through the newly formed Digital Academy as we move that forward next year. I'm conscious of time, and we had 45 minutes and we're due to finish at 1:15. So can I thank our panel members for their time today and for sharing their thoughts? And can I thank the audience for joining us from what I hope will be one of a number of webinars on this very topic, so please do give us feedback on, did this tick the box as a starter for you? Please let us know other topics you'd like us to cover, and we'd be very happy to do so as we roll these webinars out in the new year. So thank you very much and have a great afternoon.